You mentioned rare disease and just a statistic from the National Economic Burden of Rare Disease Study. It reports that more than 10,000 rare diseases affect 30 million Americans, 350 million worldwide. Half of those people are children, with a total economic burden of nearly $1 trillion. Rare diseases presents a massive opportunity for innovation and diagnostic efficiency, I guess, if you will, for treatment and development. And it's estimated that half of all of those individuals with a rare disease remain undiagnosed or misdiagnosed. And that leads to inappropriate care, um, a mountain of ineffective medical cost. But in 2013, your team launched BabySeq Project, which is the first of its kind randomized clinical trial where researchers are performing comprehensive sequencing of newborns. What's the potential of whole genome sequencing at birth?
Well, once again, when we launched this, when we started writing that grant in 2011, 2012, and we launched it in 2013, the prevailing notion was way too early for this, and that we were putting people at risk. We had colleagues who were aghast. They thought
Mhm.
we thought we were going to possibly do medical harm. We were going to create catastrophic distress and waste a tremendous amount of medical resources. And I wouldn't say we've gathered evidence to completely reassure everybody, but we've been studying this now in a randomized clinical trial format, as you said, for 10 years. And the results are really very reassuring. We have found mutations that are medically actionable. We have found children who carried these mutations that actually already had the clinical features of the condition, but nobody had detected it yet. They didn't know to look
Yeah.
uh, until you found the mutation and looked harder. We found mutations that mean a child should get a simple supplement, vitamin supplement, to prevent ongoing brain uh, damage. We've found mutations in babies where an adult cancer syndrome was in the family, and nobody in the family knew about it until we found it in the child. So the medical benefits have been startling, and we have demonstrated very clearly that the families so far who've enrolled with us were not um, extremely distressed. Even when they found out something, they were grateful for the information. Now, this is sort of because people self-select. In other words, if you don't want to know this information, if you know yourself well enough to know that it's going to be very, very upsetting, you probably won't volunteer for a study or a product when these become available. But among people who do volunteer and ask for this information and want it, there's very good accommodation, psychological accommodation to it. And then we've been tracking the spending downstream, and there is increased spending. You'd have to understand that if you find something, you're going to follow it up with echocardiograms or regular um, regular consultations with a specialist. But the costs have not been exorbitant given all the economic noise that follows a child's first couple of years of life.